When we launched our congressional campaign in North Carolina's 4th District 2 years ago, I had a very simple platform. Yes, I'm a Republican candidate, but more important than being Republican is being American. And we gave out over 50,000 copies of our Declaration of Independence and Constitution, just with the very simple idea that, you know what, we're very concerned about the world we're leaving for our kids. We're very concerned about our economic freedom and our ability to do well. Why don't we look at the rule book? Let's look at the founding documents that define how we are supposed to behave as Americans, how our government in Washington is supposed to behave. And if we don't like the direction we're going, why don't we try following the rules for a change? Very simple message, but it resonated. And we had an extremely successful grassroots campaign against our 22, now 24-year incumbent. We actually got over 150,000 votes, which at the end of the day wasn't enough to win, but it was more than previous challengers had gotten. And we raised almost $600,000 in this campaign to bring this message of local economic empowerment, creating our own businesses, creating our own jobs, lower taxes, less regulation, and letting Washington follow its own rules. We brought that message to the district. And I'm excited to do it again in 2010 because I think now, today, after the past 2 years and what we're going through economically, people are only more concerned. And I'll also talk a minute about healthcare. And one of my big concerns as a physician is that we have ripped apart, over the past 50 years, we have ripped apart the doctor-patient relationship. There's always somebody else in the room when a doctor is taking care of a patient. It's a government bureaucrat, it's an insurance company, and you look at the staff-to-provider ratios that physicians must maintain simply to get paid in the current environment. The average doctor needs 4 staff members per provider. That's just to get paid. That doesn't work. That's not sustainable. Nothing that we're doing, if you look at the way Washington works, is sustainable. So our message is very simple, and it's, look, we need a government that serves the interests of the people and follows the rules. This is not America. We are the backbone, and we need the freedom to create, grow, and develop our own businesses and our own jobs in the 4th District. So without further ado, I just wanted to kind of put my campaign out there and, frankly, take as much time as we have for questions and discussion, because I think what's really important, what I'm concerned about, is reflecting the needs and interests that the voters and that we as Americans share. Yes?
The healthcare bill is mainly an insurance fix. How would you fix healthcare?
Well, my solution to fixing healthcare is fundamentally based on giving healthcare back to the patients and providers. I think our notion of healthcare insurance, to begin with, is flawed. We call it healthcare insurance, but it's not insurance in the sense that car insurance or homeowners insurance is insurance, because we expect it to pay for everything. How much would auto insurance cost if you expected it to cover your oil changes and your fill-ups? You wouldn't be able to afford it, but yet that's what we do with healthcare. I don't know that it's quite fair to even characterize the healthcare proposal, or the proposal that's coming out of Washington is relating to insurance, because it is so all-encompassing. It's almost 2,500 pages of regulations and programs and oversight, and it criminalizes more and more and more of the doctor-patient relationship. And that's the thing that I find so concerning, is that yes, it's taking us further down the road towards a command and control economy, but what we need to do is we need to roll that back. We need to move aggressively in the other direction. I tell people this: government today is responsible for funding 2/3 of all healthcare. Between Medicare, Medicaid, DOD, VA, all the government programs that right now are paying for healthcare, that's 2/3 of the national healthcare budget. And if we don't like what we're getting with that much government, why would we want to go the rest of the way? So the healthcare solution, in my mind, involves getting the economic power and control back to the level of the individual. I'm a huge fan of healthcare savings accounts, complete tax-free savings for healthcare expenses, and doctors and hospitals need to stop playing the game of my lobbyist can beat your lobbyist to negotiate for centrally planned reimbursement levels, and we need price transparency in the market. Doctors and hospitals need to compete. We need to have entrepreneurs who can go out and say, I'm a doctor, I want to focus on running a practice that can do the best possible job getting chronic diabetics off their medications through diet and lifestyle changes. But right now, there's no real business model for that, because what government has done is they have created a centrally planned economy. Yes?
In my humble opinion, there's more broken Washington than really works. Okay? And what we've done is bifurcated the extreme left from the extreme right, and the common sense middle. And your message is really balance business and innovation against social responsibility. So that common sense middle seems to be gone. How do you get more like-minded folks like yourself to create a wave that changes, really changes, instead of rhetorically changes, what the hell is going on in Washington?
Honestly, I think it's going to require, and I don't use this term lightly, I think it requires a revolution. And I think it requires a revolution in the hearts and minds of, like you said, the largely silent but average American who knows things are deeply wrong. And that's the thing I find so exciting and so empowering, and why I was excited to reinvigorate and just restart the campaign that we had in 2008, is because the people that come to our campaign are people who want to change the world. But they know that the key to changing the world isn't even going to Washington. I'm not running saying I can fix anyone's problems. I'm just saying I want to get Washington out of the way so we can fix our own problems right here. And those are the people who need to be inspired and empowered so we can take the handcuffs off.
But the answer has become tax the rich, to give to everybody else. And in reality, what's happening with that philosophy is the rich have the best attorneys, the best loopholes, the best way of keeping their money in their corporation, and who ends up getting taxed is the middle class and the poor, which are the exact people the government says they're trying to help. So, I mean, in your opinion, how do we get this massive tax problem under control?
That's a great question. And honestly, one of the biggest cancers that's facing our economy today is the IRS and our system of income taxation. If we want more jobs, prosperity, and income, why are we taxing jobs, prosperity, and income? It doesn't make sense. And the issue with, how do you fund government? Well, government needs to be a lot smaller. I've been a Republican my entire life, but there hasn't been a Republican administration that's actually shrunk government. And I think that's why the message of the Constitution is so important, because whatever party you belong to, if you believe that Washington is out of control and Washington is too big and Washington is only enabling moral hazard and bailouts and all these bad things that are taking away from our children's future, we've got to start shutting things down. And I don't mean scaling back spending. I'm not talking about programs. I'm talking about departments. I'm talking about, do we really need a federal Department of Education? When you look at the havoc that Washington's education dollars do when they come here to North Carolina and Wake County, this is something that's only been in existence since the Carter administration. We don't need a Department of Education. But before we can address taxing, we have to address our spending problem. And we have to take a hard look at the entitlement problems we face, because we've made a lot of promises that our government's not in a position to keep unless we start talking about default or massive inflation.